The Ministry of Health wants to administer HPV vaccines to 4,400 schoolgirls between the ages of 9 to 13. While the plan is to include the vaccine in the yearly national vaccine schedule, this vaccine isn't mandatory. Parents will have to provide written consent for their child or children to receive the vaccine.
The WHO suggests that we should be vaccinating girls between 9 to 13 years. That's before they start to have sexual life. But we had to establish a cohort as we are introducing this, and based on the attendance rate that we have from schools, which is where most of the girls at this age group are, the standard 4 classrooms are the ones that are being selected to be part of this first initial phase, and that's an estimated 4,400 girls across Belize.
The way how we are envisioning the administration of the vaccine is that first we meet with the parents, we provide them with the information, we invite them to sign the consent form. We want them to receive the information and make the decision, and as Dr. Manzanero was mentioning earlier, we need to document the yes or the no for authorizing the child to receive the vaccine.
So what is the HPV and what is this vaccine? The HPV is the human papilloma virus, one of the most commonly sexually transmitted infections. In 2006, a vaccine was introduced to prevent some of the HPV health effects. The HPV is known to be one of the causes of cervical cancer. In Belize, people are still dying from this treatable and preventable disease.
There's lots of data suggesting that we have higher rates of cervical cancer. Unfortunately, cervical cancer we are identifying in very late stages of the disease. It's not that people are coming in the early stage. Data from last year, for example, that we have managed to capture in the BHIS suggests that there were 21 cases. 13 patients died as a result of cervical cancer last year. These are all preventable diseases. HPV is one such preventative measure that we can implement to try to curtail the number of cervical cancer cases. This is about females, and even though we won't really be addressing the male situation, HPV, the human papilloma virus, has also been linked to some oral cancers in males, been linked to anal cancers and penile cancers. They are not that frequent, but that's something that I think we also need to be aware of.
Almost $250,000 funded by the Social Security Board was used to procure around 17,000 vaccines. They will be administered in 2 doses at the schools by medical practitioners who have been trained specially to administer them. The Ministry of Health says that there will be minor side effects.
It's 2 doses that will be given, 1 initial dose, and the patient has to come back 6 months later to get a second dose. It is an intramuscular injection, just like the tetanus shot. There will be an effort also to get to the out-of-school girls that are not just in high school setting. The average cost when that was procured is about $10 per dose. So in getting 2 doses, it's $20, but that doesn't include the internal logistics, the human resources, the needles, the cotton swabs, and all those other things that are used to give an injection. So on average, every full dose, the two doses is going to cost $40 Belize plus all the other costs as they come along.
Similar like with other vaccines, pain, redness, and swelling in the injection site. Some rare effects are listed. It's a huge list, and they are not specific to directly link to the HPV, and there are some very rare side effects with 0.05% that can also present with other conditions, not only administering HPV vaccine. But we have a surveillance system in place, and parents are encouraged to report any side effect other than the most common that is expected, and then an investigation is conducted to try to establish if there is any link.
At this moment, with our experience in the private sector, basically the side effects is minimal and is localized in the area of the injection.
As I said, this is an investment. You want to see almost $250,000 If you want to do the math with that, though, that is equivalent to treating 6 persons who are at the end stage of cervical cancer. And that doesn't factor in the quality adjusted life years and all those other factors, economic factors of having lost somebody who may be at a very productive age. So those are other factors that are not in here.
But just how effective will this vaccine be? Since 2007, countries like Australia and the US have recorded dramatic decrease in infections in genital warts within 3 years, and the Ministry of Health believes that Belize will see similar success. But as it relates to cervical cancer, the effectiveness will not be evident until some 15 or more years.
The vaccine is pretty much effective. Cervical cancer is known to be caused by HPV. We have more than 150 different types of HPV. 13 of them are related to cancer, and 16 and 18 is what contain the vaccine currently that we will be using. Confer protection against 70% of the causes of cervical cancer. We won't see numbers falling when it comes to cervical cancer because that's a process that takes 15 years, 10 years. And if the person have immune compromise because of conditions that they may have, this is shortened to 5 to 10 years. So it's kind of a difficult to project, but we won't see the actual reduction in cervical cancer cases until probably 10 years from now. But what we will see immediately is the reduction in the HPV infections. That will lead to cervical cancer. And that is what we're looking for.
But to see that reduction in HPV-related infections, parents and other agencies must be on board. A number of consultations and meetings have been held since 2015, and there will be even more sensitization meetings with parents. Ministry of Education and the faith-based schools say they support this initiative.
It's important that the parents understand that this is a cancer prevention strategy. It's not treating them for anything. It's not encouraging the children to do anything. It is part of the vaccine schedule. And as such, it's a public health issue.
We intend to educate all girls, girls and boys, everyone, and we intend to do that through our health and family life education program. And so we're also going to meet with our curriculum unit, and Dr. Bear and Ms. Lara and their team will meet with them, and we will ensure that this is included, that this vaccine is included as quickly as possible to ensure that all students are aware of the importance of this vaccine.
We're very concerned about the situation since the churches and the faith-based organization have to deal with the reactive care of cancer. We are the ones, besides the doctors and the nurses, who have access to these patients. After they're sent home and there's no hope, we have to provide spiritual mentoring and help, not only the patient, but the families waiting to see their loved ones die. And so when this came aboard, it was for us of a concern that we would approve such a program to be preventative, not as reactive, but to be proactive in dealing with some of the circumstances.
Reporting for News 5, I'm Andrea Polanco.